This is Trevor Benko, CEO of TGB Supplements.
This is Ben Jordan, CEO of TGB Supplements.
And today we're going to talk about how to maximize your hormone replacement therapy in men, of course. Before we get started, this is not medical advice. This is just our opinion, and we're using our judgment, dealing with many customers that are on hormone replacement therapy as well as ourselves to gather this opinion. So once again, it's not medical advice, just our opinion. So to get started, some of the issues that and things that we run into with our customers, I guess, would be like elevated hematocrit, increased estradiol, sometimes acne due to DHT conversion or due to an elevated estradiol, and those are the things we're going to talk about in this video.
Okay, we'll touch on hematocrit first. Hematocrit is elevated red blood cell count. That comes from having an excess level of testosterone, higher sometimes than the natural limit in a supraphysiological range. That is possible with a 200 milligrams per milliliter dose per week. So if you could use some natural supplements such as Blackline Research Viron, which has boron, tongadali, and stinging nettle is another compound. That will help bind to, it's called sex hormone binding globulin. That enzyme will bind to our testosterone and enable it inactive. It won't allow it to bind to the androgen receptor. So you might have to take more testosterone to get to the numbers that you need to get to. Another thing would be the aromatase enzymes. Using an aromatase inhibitor will bind to that enzyme and not allow it to convert our testosterone to estrogen. Again, another enzyme that could cause us to need to use more testosterone than what we need to get to that certain reference range.
Yeah, so like Ben was saying, a product like Viron is a natural way to free up more testosterone. Like he was saying, there's something called the sex hormone binding globulin. When your sex hormone binding globulin binds to your testosterone, it pretty much renders it inactive. That's why there's a total testosterone and a free testosterone. So, like he was saying, if you're using 100 milligrams of testosterone, if you're using Viron with it, you may be able to get the benefits as if you were using 150 or maybe even 200 milligrams of testosterone. And you can actually have a blood test done to show you the difference. And that's actually what we would recommend. Another thing, like you said, with the estradiol, an aromatase inhibitor, your estradiol is going to become elevated when you're taking more testosterone than what is normal for your body, which would be almost any dose of hormone replacement therapy. It's just a matter of time. We see it all the time. A lot of doctors don't prescribe aromatase inhibitors, and if they don't prescribe you an aromatase inhibitor and you're on hormone replacement therapy, I suggest that you get your estradiol checked, and if it is elevated and the doctor doesn't want to do anything, then you should look into other ways to lower your estradiol. And some of those ways would be natural supplements. Blackline Research has another product called Letrone, which is a capsule. It's the most potent capsule out there for aromatase inhibition, I believe. Also, they have another product which is transdermal called Exotherm. Now, Exotherm is very similar. It's an aromatase inhibitor, but it's also a topical fat burner. Another product, probably the most potent one that we believe on the market now, is the Iron Legion Virtus. Virtus is very similar as far as its effects to the drug Arimidex or anastrozole. There's been a few people that have posted blood work on anastrozole and also on Virtus and had very similar results.
Yeah, one of our customers, he was on 400 milligrams of testosterone a week, and it had his reference range within 3 points of his common dosage of Arimidex. So, I mean, that's just one guy, but that shows the potential of the Virtus for what it can do for the aromatase enzyme.
Yeah, now everybody's different, so you want to check this out for yourself. And the only way to do that is to have blood work done at least a couple of times a year. Also, some of the other things, like we were talking about, some of the issues to help maximize your testosterone. One of the big things people sometimes get is acne. Acne can sometimes cause a lot of problems. There's a lot of things you can do to help control acne. One of them is to keep a clean shirt on, change your shirt a couple of times a day. Always try to sleep in a t-shirt. Shower after you work out. Anytime you work out, try to get a shower immediately after. Don't let the sweat sit on your skin. That helps keep the skin clean. If that's not enough, you want to really focus on the levels of your hormones. Usually that's where you're having an increase in acne. If your estradiol is elevated, that's going to cause acne. If your DHT is elevated, that can cause acne. So those are usually, a blood test would show you maybe which one is elevated, so you can kind of focus on getting it in line. And if you're still having problems, you could take some natural supplements. B5 in high doses works really well. Any other suggestions?
Yeah, I mean, touching on the estradiol a little bit again, going back to it, if you do have a doctor that works with you and sets you up, it's going to be your Remodex. That's great. You got a good doctor that's helping you out. If not, and you try one of the natural alternatives and it's not quite potent enough for you, you could look into aromacin or exemestane. That's actually our preferred aromatase inhibitor because it's a suicidal aromatase inhibitor. What that means is, say you took your dose today and you miss it, say tomorrow you're not able to get it at the same time, your estrogen will slowly come back up. It slowly tapers down. So you won't have the rebound effect that you would have like in a Remodex. So it's a lot more user friendly and side effect friendly. Plus it acts like an androgen as well, so you get a little of a hardening effect and a little bit of an anabolic effect off of it.
Yeah, we also believe that aromacin or exemestane is a little bit milder on your cholesterol levels. Even though it is an androgen, a Remodex can sometimes be very harsh on your HDL, your good cholesterol, and from what we've seen, aromacin usually is a little bit milder. With that in mind, you still need to be aware of your cholesterol levels and try to keep your HDL as high as possible. To do that, you want to keep a diet high in healthy fats. We like to use things like natural almond butter. We sell the P28 almond butter. Also natural peanut butters, natural nuts, macadamia nuts, cashews, almonds, avocado oil. We carry that as well through Species Nutrition, Dave Palumbo's product. Very big believer in that product. We also have the Now food supplements, which they have a lot of the nuts. They have Marcona almonds. They have macadamia nuts. We have macadamia nut oil through them, avocado oil through them. Anything else?
Yeah, we'll touch on the frequency of the dosing and the types of dosing of the testosterone as well. With the side effects such as the hematocrit and the estradiol DHT conversion, that can come from not having a stable hormonal balance of the testosterone. So getting it from an injectable form, which is the preferred form, you're able to keep a more stable plasma level, so you know what reference range you're working with to control that estradiol and that hematocrit.
Yeah, splitting your injection, let's say if you're prescribed 200 milligrams a week, if you were to split that into two 100 milligram injections, you're going to have much more stability in your blood levels, less peaks and troughs. So you're going to have less big jumps and drops. You're going to have less lows. So that's always going to prevent a lot more side effects as far as estradiol, even red blood cells, and hematocrit levels. The more stable you can keep your levels, the better you're going to feel and the less side effects you're going to have long term.
Yeah, the cream form and the pellet form we never recommend. Doctors, they try to give the cream form most of the time just because they make more money off of it. There's a convenience aspect, but you got to watch out because you can get contact transfer to your loved ones. It's a lot worse for females and children. It can cause some bad side effects. Plus, in the skin, we have a higher concentration of SHBG, which what we touched on earlier. That's going to convert most of that testosterone and not allow it to bind to the androgen receptor.
Yeah, it actually binds the testosterone up, like Ben said, and prevents it from being free, so it renders it almost inactive. And that's taking away. So what we're doing in this video is trying to tell you ways to maximize your hormone replacement. So that's one of the things that if you can avoid the gels, we would definitely recommend doing so. Nobody likes to use needles and inject once a week or twice a week. So some other tips that you can do to make injection a little bit easier. You can always put, one, you want to draw with a needle that's larger than the needle that you inject with. A lot of times doctors will recommend a 22 gauge or 23 gauge needle. You don't have to use that large of a gauge. So a smaller needle would actually be a 25 gauge or a 26 gauge. If you can find a 25 or 26 gauge 1 inch, that's usually enough for the quadriceps, the glutes, even the shoulders. You can take those tips and actually put them in the freezer prior to your injection. That will sometimes, the coldness will numb the nerves in the skin and you won't feel it go through as much.
Yeah, and you can even heat your oil up a little bit in the vial. Just run the end of it on some hot water. That'll make the oil a little bit thinner, so with the smaller gauge needle it can bypass through it a lot quicker.
Yeah, and, or like Ben was saying with heating it up, you could use a small heating pad. You don't want to get too hot, but just warm it up a little bit, and that'll make it go through a lot more smoothly. Another thing that some guys do now is use an insulin needle. Now this is a little more advanced technique, which we'll get into at a later time. We'll actually do an injection video and show you how to do this. But that is one thing that is done on a more common basis now, and people seem to like that.
Yeah, they're even starting to get in some sub-Q injections for the testosterone. They're seeing a lot more stable blood levels.
Yeah, actually, like Ben was saying, there's been some studies done now that show that injecting it subcutaneously actually you can get more out of your testosterone. They're saying 20%, which is a pretty large number. So I'm not sure, how true that is, but it seems to be the new thing coming. But now, obviously, when you do subcutaneous injections, they got to be in lower doses because it'll cause inflammation and some welts, that kind of thing. So, like I said, we will do a video showing you how to do subcutaneous testosterone replacement injection.
Yeah, and if that does come into effect, that they find that is true, that you get that 20% increase, that's beneficial for everybody on hormone replacement. So they won't have to use as much testosterone to get their desired blood levels. So in turn, you won't have an elevated hematocrit. Your estradiol will be a lot more easier to control. So it'll just make it all around more user friendly for the guys.
Yeah, definitely. I mean, that's the goal. You got to think about your long-term health. It's not about building how much muscle you can build. It's about what is going to be the optimal level for you to maintain your health as you age and get older. You want to stay young and healthy as long as you can. And we're firm believers that hormone replacement therapy is the way to do that as you age. Now, only if necessary. There's a lot of guys that want to get on hormone replacement therapy that don't need it. We definitely don't suggest that. I mean, when you get on hormone replacement therapy, for one, you got to do an injection every week for the rest of your life, at least one. And two, if you ever want to have children, you may never be able to have children. It's possible that you could, but it's going to be more difficult. And you're just abusing the system, because there are people out there that need it, even young guys. There are guys, just because you're in your 20s doesn't mean you don't need hormone replacement therapy. We've seen it ourselves firsthand. So there are guys out there that are young that do need hormone replacement therapy, and so we don't recommend getting on it unless you do need it. But if you are going to be on it, you might as well get the most out of it, and like we were saying, try to prevent as many side effects as possible. And another thing with the hematocrit, the elevated hematocrit levels, a big part of that is staying hydrated. If you're hydrated, your levels are going to be more accurate when you get your blood test done, and that's something you want to do all the time, not just for your blood test. You want to stay hydrated all the time. Your blood is made up a lot of water, so keeping that water high will help prevent a lot of issues and keep your levels low.
Yeah, if your body's deficient in oxygen, which comes from staying hydrated, it wants to increase the red blood cell production because they carry oxygen. So it will try to boost that to make the body more efficient at using that oxygen from having more red blood cells. So that's really important.
And we're staying on the hematocrit and red blood cells a little bit more so than others. But I would say it's very common over time, not at first. It's usually like 6 months to a year or 2 years into androgen replacement therapy, hormone replacement therapy, that you start to see these elevations. It takes time, but your body will start to produce more red blood cells, which is good until they get to a certain point where they're too high. And then you start to lose your endurance. So if you feel like you're tired in between sets, you're huffing and puffing, you're not really doing a lot of work, you shouldn't be that tired, there's a good chance that you could have an elevated hematocrit. Now, an elevated hematocrit and red blood cells can be dangerous because it can actually increase your risk for heart attack, stroke. It can lead to high blood pressure, can lead to an enlarged heart, a lot of issues. And one other thing we want to talk about that could contribute to that is sleep apnea. Many bodybuilders have sleep apnea and don't realize it. If you have a thick neck, muscular neck, it's very likely that you could have sleep apnea. If you snore, and most likely you have some type of sleep apnea to some extent. Now, if you see an elevation in your hematocrit, red blood cells, hemoglobin, you snore, and you have a pretty large neck, I definitely suggest that you get a sleep study done to see if you have sleep apnea. If you do, wearing a CPAP or a BiPAP could very well help lower your hematocrit and hemoglobin, your red blood cells, significantly.
Yeah, one other thing with hematocrit that we forgot to touch on, which is more so in super physiological doses with guys, but this is the common killer of professional bodybuilders. It's from the hematocrit, it's the kidneys. The kidneys filter that blood. It gets damaged over time because the blood's so thick, the kidney can't filter it. So those kidney cells get damaged and destroyed, and the kidneys are everything. It's not like the liver that can regenerate.
Yeah, I've talked to a few different professional bodybuilders, and some of the guys that I've talked to, I've discussed the fact that I've had an elevated hematocrit in my life. I have sleep apnea. I am on hormone replacement therapy. I very rarely go higher than hormone replacement therapy doses anymore, and my levels go up, on a pretty regular basis. At least once a year, I get my blood checked, and usually they're on the higher side. I've even had to do phlebotomy one time to get the levels down. I had to donate 500 milliliters of blood, which I'm not too fond of. I don't like to do, but if you got to do it, you got to do it. And one of the professional bodybuilders I was speaking with was telling me about his blood levels, and I thought mine were high. His were a lot higher than mine. I mean, his hematocrit was almost a 55. I think mine was 52.4, and that was bad. So 55, 56, I mean, that's really bad. And he said he was just using lots of stuff and never checked it. I mean, we know lots of guys that are on anabolics in super physiological doses that run them year round, and they're not getting their blood levels checked. And I mean, to those guys, we're telling you, you need to have some type of blood work done because it's going to catch up to you. Just because you don't feel it doesn't mean it's not there. And you can't ignore it. I mean, working out like that and putting that stress on your heart, I mean, that's permanent. You're going to cause permanent damage to yourself.
Yeah, if you wait, which most of us do, we hate seeing the doctors, we hate shots, we hate having blood drawn. If you wait to the point that you notice something, that you have a problem that you have to get checked out, odds are it's a little bit too late. That's why it's very important having the blood work done so you can make sure that you mitigate that chance of having a problem like that, because this is a long-term thing.
Yes. And yeah, this is more of a marathon than a sprint. Bodybuilding is it's a lifelong commitment, and you got to do it 24/7. So just like training and diet, it takes time. You're not going to build an amazing physique overnight, even with performance-enhancing drugs. So with that in mind, you got to take care of your health, and that's why we're saying some of the things we are tonight. Going back one more time to the elevated estradiol, it is very important to make sure that your levels are in range. And this is probably the most common thing that we see. Most guys that are prescribed testosterone, most of them are not given an aromatase inhibitor. So usually you might have to do this on your own. And at the very least, get a blood test done. At least ask your doctor to do the blood work. If they're not willing to do anything, you can do something yourself.
Yeah, a lot of the PCPs, they don't really have much knowledge in that aspect. They'd want to give you a crazy dose of, say, 200 milligrams a month or 100 milligrams every 2 weeks. Even some specialists with
Endocrinologists.
Endocrinologists, they're not very in tune with the aromatase inhibitors. They'll give you a proper dosage of testosterone, but they don't think that you need the aromatase inhibitor because it's a female breast cancer drug. But it is necessary for controlling that estradiol.
Yeah, usually bodybuilders are a little bit ahead of the time in the medical studies, because they're experimenting on themselves. So this is something that bodybuilders have been using for years, but it's just now starting to get accepted in the medical community. Some of the doctors that are up on hormone replacement are doing it, but not very many PCPs or even endocrinologists. And like Ben was saying, many of them don't even give you the proper dosing. So if your dosing is different than what we were discussing, 200 milligrams a week or 100 milligrams twice a week, you may not need that much. That's the upper end. But if you're only getting one 200 milligram shot every 4 weeks or every 2 weeks, then you're definitely not maximizing your natural or your testosterone levels in your health. You could be getting much more with a lot less side effects by doing it differently.
Yeah, if your doctor is not helping you out with the estradiol, if you're not fond of transdermals, or if you got some children or wives, look into the Letrium from Blackline Research. If you could rather go the transdermal version, they typically work a little bit better because there's no methylation attachment to them, so the liver can't tear it up. And if those don't quite get your estradiol in check, I'd look into the Aromacin or the Exemestane. Odds are a 12.5 milligrams every other day would be plenty for you. If you're very sensitive, you probably have to do 25 milligrams every other day, but that should definitely get your estrogen in check.
Yeah, I mean that's a pretty good dose, and you shouldn't have any issues there. And like we were saying, everything in moderation. You don't want to use more than you need to, so it's important to follow up with blood work to see that you're in range. If you need anything else, I mean, if your doctor isn't prescribing those correct doses, then you should go look for another doctor that's willing to work with you or at least hear you out. There are doctors out there that are knowledgeable. So
yeah, and we don't like talking just as being guys. We don't like asking other guys for help with, say, testosterone, or our mood might not be as good, or libido might not be as high. But most of us guys have problems with that. Just talk to another guy. He might have already went through what you went through, and can get you set up with a good doctor if your doctor's not very willing to help you out.
Yeah, it's a common thing now. So don't feel like you're abnormal, or feel like you're less of a man because you need testosterone. Everybody's going to need testosterone at some point or another. If you live long enough, everybody will need it. Honestly, it's very rare for us to see guys with a high testosterone naturally anymore. I've only seen probably 2 guys in the last year that have showed me blood work that was higher than 800.
Yeah, and they're older guys. It seems like a lot of the younger generation, it's because all the preservatives and stuff that they're putting in the food. It's the older generation. They got higher testosterone levels than us young guys.
Yeah, that's true. I mean, from what we've seen, at least in our area, I mean, that's definitely very true. Well, I think that pretty much covers it.
Yeah, we've kind of touched on all the side effects, the testosterone, and the applications of it. If you guys have any questions, you can shoot us a text or call. We'll leave our number and email in the link below.
Yeah, you can email us anytime, call us, talk to us directly. If you'd rather come in and sit with us one-on-one, we can set up a consultation. Whatever is good for you, we just want to try to do our best to help you out. There are natural supplements that can be used to maximize your testosterone. Some of the ones we talked about were the Black Lion Research Veron, Black Lion Research Exotherm, Electron,
Iron Legion Viritus.
Iron Legion Viritus. Those are some of the most common ones that we recommend. If you need anything else, or you want us to do a video on some other part of hormone replacement, like we were talking about doing the injection video, please let us know in the comments or shoot us an email. And we're planning on doing many more videos in the near future. We've been thinking about doing this for a while, and it's finally time that we're making time to get it done. So we talk about this stuff every single day in our store with our customers.
Yeah, it'd be nice too, just doing the videos, because we're kind of putting that information out there, because like I was touching on earlier, some guys, they might not want to come in and talk to us because they might feel that it's embarrassing, or they just don't have it to talk to another man about that. So this could help people as well, so we're glad to be able to do it.
Yeah, well, I guess we'll be talking to you guys again here soon, and look forward to doing another video for you.